Good evening. Arrhythmia or heart rhythm disorder is a general term for an irregular heartbeat. Most arrhythmias are not dangerous, but some may indicate serious underlying heart disease, and some can lead to serious problems such as loss of consciousness, stroke, and sudden cardiac death. To know more about heart rhythm disorders or arrhythmia, we have with us today Dr. A. M. Karthigesan, Senior Consultant Cardiologist and electrophysiologist at Apollo Hospitals, Greens Road, Chennai. Good evening, doctor.
Good evening, viewers.
What is arrhythmia, doctor?
See, commonly we know that we know our pulse. So whenever you go to the doctor and consult, the first thing they do it is check your pulse. What is your pulse rate? So the pulse rate means how many times your heart is beating per minute. So the human heart normally beats at the rate of 60 to 100 beats per minute. That is called pulse rate. So we commonly call know your pulse. Whenever you go to the doctor, they check your pulse. In this pulse per minute, the heart is beating. It is monitored by monitoring your pulse by palpating at the radial artery. What happens is sometimes the pulse started varying it. Somebody's heart rate suddenly goes above 100, 150, 200, 300, like that. It started going very fast. Sometimes it goes very slow, like 30, 40, even 20. Sometimes, heart skips and stops for a while, few seconds, heart doesn't beat at all. So these are all out of variation. There is not falling in the normal range. So that is called cardiac rhythm disorder or heartbeat disorder or arrhythmia, we call. That is, whenever the heart is not beating within the normal range, it goes out of the range. If it goes above 100, it is called tachyarrhythmia. If it falls below 50, it is called bradyarrhythmia, that is slow heartbeat.
And what are the common causes of heartbeat rhythm disorders?
Yeah, it's a good question. So the common rhythm disorder, some of the things are physiological. Suppose the heart rate is slow heart beating. So patient tells my heart rate is always 48, 50 only, doctor. There is they may be athletic background, or they may be doing vigorous exercise, all those things. These are all physiological. When aggressive trained sports person, heart rate will be a lot lower than normal human being. So normal, some age related, the same person. Somebody is having suffering fever or illnesses, heart rate will be more than 100, 110, 120 because of their sickness. These are all we call physiological. But sometimes pathologically, without any reason, the person while sitting or standing itself, heart rate goes up to 180, 200, then that becomes a problem, abnormal. Or without any reason, heart rate is lower than normal, then again that is also a normal. If you ask for a reason, common causes, for a reason, one is some of the things, it depends on the age group. Some of the things are birth defects, especially in the children and born babies. Or by the way, the heart rhythm disorder doesn't have any age group. From birth to death, at any age, at any different kinds of rhythm disorder, the pulse variation can happen. Some of the pulse rhythm disorders at the younger age, childhood ages, are genetic or maybe birth defects. Some of the things that happens in the middle age and all could be a birth defect which manifests at the middle age. Some of the things happens at the old age, could be most of the time middle age and old age, could be due to the hypertension, diabetes, high cholesterol, obesity, or sleep-related disorder, what we call obstructive sleep apnea. People snore a lot during night time. So these are the common, some of the causes are those who suffered a heart attack already, those who are having poor pumping function because of their heart attack, heart has damaged, pumping is weak. These are the things can manifest like a rhythm disorder. They come with the erratic heart beatings, which turns related to various symptoms.
How are they diagnosed, or rather, what are the symptoms of heartbeat rhythm disorder?
It's very important to recognize symptoms. Many times people feel they don't realize their symptoms. The first symptoms varies, whenever as we know that heartbeat goes very fast. As now when we are sitting or doing our routine work, when the heart is beating at 70, 80 beats per minute, we don't even realize that our heart is working. It doesn't seek our attention. At the same time, the heartbeat jumps into twice of normal or 3 times of normal, like 150, 160, 180. If it goes, people cannot be comfortable. It seeks your attention. It's because you realize that heart is going very fast. They feel like, something running inside my chest or fluttering sensation like that they feel. And they feel because the high heart rate, somebody's BP can drop. So they may feel giddiness and maybe they lose conscious. Sometimes they may feel some with chest pain, that they may get sweaty. And they have to take rest till the heart rate subsides to come back to normal. They will not be comfortable. The same problem happens with the elderly people or those who suffered already heart attack. They can get into breathing difficulty, breathlessness, or they may come to the rush to the emergency because of breathing difficulty. On the contrary, the heart rate slows down, so below normal, that is less than 50, it slows down. They may feel fatigue, tiredness. They may not able to exert themselves. If they walk, they feel tired or they may become breathless. If the falls very low, they may feel very often giddiness or they may lose frequently conscious. They lose such a way that they lose conscious within few seconds, they'll recover, come back to normal. So that are frequent episodes of giddiness or unconsciousness, fatigue, tiredness, breathlessness. These are the symptoms of low heartbeat. Palpitation and breathing difficulty, fluttering sensation in the chest, giddiness, again the loss of consciousness may be the manifestation of the fast heartbeat also.
And is arrhythmia curable?
Yeah, so arrhythmia is a potentially curable problem. As I mentioned, there are various varieties of rhythm disorders are there from the birth to death. Okay, so some of the things are genetic in nature, may not be curable. It may be we need to medications and some of the device needs some pacemakers or some of the device implantation is required. Some of the rhythm disorder, especially faster heartbeats, which could be due from birth disorder, or it could happen during the course of their lifetime in the middle age or elderly age. Many of the fast heartbeats are potentially curable problems. One is the first, they will try medications. Those who don't want to take medication, those who are not tolerating medications, or the medication is not advisable in particular subset of patients, we recommend the treatment called radiofrequency ablation. That is called electrophysiology study and radiofrequency ablation. What do you mean by radiofrequency ablation? That is a form of alternating current. We find out the source of this abnormal electrical impulse, why this fast heartbeat is happening from somebody's heart. We find out that site within the four chambers of the heart, which chamber is the culprit, identify the site of the impulse generation. Say, as I said, somebody's heart rate is going to 180, 200. We find out which part of the heart is producing suddenly that faster heartbeat. Identify that from the electrophysiology study and then remove that spot by delivering a radiofrequency energy. By doing that, we can cure this problem. It's a potentially curable problem. So majority of the rhythm, especially fast heart rhythm disorders, can be potentially curable by radiofrequency ablation. So by doing that, we are improving the patient's quality of life. We are avoiding patients repeatedly getting admitted in the hospital. And then we are saving cost to the patient because repeated admission incurs a lot of cost to the patient. So by one-time cure-up treatment, they can avoid taking lifelong medical treatment, as well as they can avoid this repeated admissions. Their quality of life gets improved much better.
Hello, doctor. I am 40 years old male, and my heartbeat is always 63 and my BP is at 140/90. Could you tell me if I'm having an abnormal heartbeat? If so, what is the reason?
No, 63 is, as I mentioned, 63 is a normal heartbeat. Somebody's heart rate can be 50 to 100 is normal at resting stage. 63 is a very good heart rate. There is no need to worry. And you, the symptom, the BP recording which you're showing is a higher recording. Is 130 is 90 for your age, is slightly 10 millimeter more than the diastolic ratio is higher side. Or you need to observe it. You can cut down the salt intake. You can go for regular walking and periodically measure your blood pressure with your family doctor and measure it. If it is consistently high at follow-up recording in spite of your lifestyle and food habit change, then you can go for a medical treatment, antihypertensive medication to reduce your blood pressure.
Speaking of abnormal heartbeat, which he had asked, what causes abnormal heartbeat, doctor?
Yeah, so as causes varies, as this rhythm disorders happens from the birth to death, their causes also varies from birth to at a very different age group, it varies differently. If we take into account of middle age and elderly age group, the most common reason or cause itself is the age itself is a problem. Elderly people are more prone to develop various rhythm disorders. The electrical impulse maybe slows down, electrical impulse not get produced, so the heartbeat gets slows down. Sometimes electrical impulse excessively generated, become faster heartbeat. So aging itself is a age group. Age group people are getting to more rhythm disorders, slow or fast heartbeat. So if you leave the age, what are the other causes if you come across? Most common thing is hypertension, high BP, uncontrolled high blood pressure, long-standing hypertensive patients, diabetic patients, cholesterol, dyslipidemic patients, or those who suffered a heart attack already and pumping is weak. As I mentioned, obesity, overweight patient, and sleep disorder, that is obstructive sleep apnea patients, bronchial asthma or COPD we call, those are inhalers and other things, they're using it. Those are the people who are the thyroid disorders, especially over functioning of thyroid. These are some of the common reasons at the middle age group or elderly people get into rhythm disorder, especially faster heartbeats. Slower heartbeats are measured at time due to aging problem, inherent electrical impulse, which is heart is running with electrical system, which fails due to aging process, the heart slows down. Faster heartbeats are due to, these are the lifestyle problems. If we come out of the childhood age, younger age group, if we see birth to school-going children, some of the things are genetic in nature. People can get to whether the birth onwards, the heart, some genetic channelopathy we call, erratic heart beating, that manifestation will be repeated loss of consciousness. And when you take ECG, you will find some genetic problem is there. Some of the things are genetic in nature. Some of the things are birth defects. 1 in 1,000 people are born with some extra electrical wire connection. So because of the extra electrical wire, the child will be getting repeated palpitation episodes, repeatedly heart rate going to 200, 250. So these are the birth defects, which is potentially curable. Genetic problems are manageable with medical treatment or device implants, or pacemakers or ICD device implants. And birth electrical wire connection is potentially curable problem by radiofrequency ablations. So middle age, these lifestyle disorders are taken into account for the rhythm disorders.
You spoke about treatment options for arrhythmia. Can you tell us a little bit more about it? What are the best treatment options available for our patients today?
Yeah. So the treatment disorder, broadly the rhythm disorder, as I already mentioned, tachy and bradyarrhythmia. Bradyarrhythmia means a slow heartbeat, below normal heartbeat. For those patients, if they are symptomatic, they need to undergo permanent pacemaker implantations. They are not heart rate is as expectedly, it is not normal. They have to go for a permanent pacemaker implantation. What it does is the pacemaker, which is a small battery which is connected to the heart through the leads, the wires, it maintains the patient's heartbeat. We can set what rate it should beat, 60 or 70, we can beat it. When the patient exerts themselves, and the pacemaker recognizes that the patient's activity and proportionately increases the heart activity, which is not happening because of the own electrical God-given pacemaker is not failed and not working properly. So the artificial battery, which generates the impulse and gives currents to the heart and makes the heart to uninterruptedly working according to the patient needs. So the low heartbeat needs permanent pacemaker, which cannot be cured by any of these invasive methods except pacemaker implantation. Faster heartbeats, the erratic, that is tachyarrhythmias, which can be divided into two different problems. One is the upper chamber of the heart is beating very fast. Upper chamber of the heart is beating very fast. The treatments are only medical treatment, or most of the time we recommend radiofrequency ablation, which is a potentially curable problem. So the patients need not take lifelong medical treatment. Most of the upper chamber electrical problems, that is faster heartbeats, are curable by radiofrequency ablation. Suppose the patient gets faster heartbeat from the lower chambers, what we call the upper chamber, what I meant was the supraventricular tachycardia, SVT. Many of you have heard the term SVT. I am suffering from SVT, doctor. The sudden rapid rise in the heartbeat, then within a few minutes or few seconds, it stops on its own. So these are all potentially curable problem by radiofrequency ablation. The lower chamber problem, that is called ventricular tachycardia. So ventricular tachycardias are sometimes, it can happen in a structurally normal heart, the younger patient also, which is again potentially curable by radiofrequency ablation. We don't recommend lifelong medical treatment for younger people, those we don't want to live with the medical therapy for 40, 50 years. So we go for a curative treatment by radiofrequency ablations. But the lower chamber heartbeat, that is ventricular tachycardia, sometimes life-threatening in a patient who already suffered a heart attack, a damaged heart, that pumping is very weak. When they develop this ventricular tachycardia, which can lead to what you call sudden cardiac arrest, it can lead to life-threatening problem. For those patients, we recommend two treatments. One is radiofrequency ablation as well as implantable devices, which is an advanced type of pacemaker, like called ICD, implantable cardioverter defibrillator. What with the device does is, which is implanted in the pectoral region under the collarbone, below the collarbone, the wire goes inside the heart and connected to the heart. Through that wire, which we call lead, continuously the device monitors the patient's heartbeat. At any point of time, the patient's heartbeat goes very erratic and fast, which can lead to stopping his heart, or he can die suddenly within few seconds. In that moment, the machine recognizes it and delivers a shock and revives the heart back to normal. By doing that, the device that is called ICD saves the patient's life. That is recommended for the patient, those who are the poor ejection fraction because of the previous heart attack or previous infection, heart pumping has gone down below 35%. And we recommend this treatment. Those who suffered already ventricular tachycardia, they must undergo this device implantation to prevent their further episodes and dying suddenly. And those who are likelihood of getting this problem in future because of the poor pumping, so we don't want to wait them to suffer this problem. So upfront, we recommend them to go for electively pacemaker implant, this ICD implantation, so that at any point of their life, if they encounter this problem, they will not get into life danger. So the machine revives their life and safeguard them.
What is the lifetime of these machines, doctor?
Yeah, it's a very important question. So many patients wants to know once they implant any device. We call cardiac implantable electronic devices, CAED. So there are umpty number of varieties of machines are available for various reasons. As I said, starting from the simple pacemaker, those who have the low heartbeat, for some ICD for those patients having faster heartbeat, for those patients poor ejection fraction and heart failure patient to improve their pumping function. We do call cardiac resynchronization therapy, CRT device, that is triple chamber pacemaker. So like that, we can do devices for monitoring their heartbeat for a couple of years. So like ILR. So like there's so many implantable devices we will put it. By and large, the longevity of the device, because it's operated by a battery, it has a longevity. So that the pacemakers lasting for almost 10 years. It will, by and large, it will come for 10 years. Higher end this ICD heart failure devices, the current technology also it comes to 78 years, 9 years. It will come, depends on the utility of for that particular patient. Anywhere between 8 years, it will last long.
Hello, doctor. I'm a 24-year-old male from Chennai. My height is 5'9" and my weight is 80 kgs. I work out regularly, but for the past few days, I am suddenly feeling my heart beating faster than usual. It comes and goes. I'm scared sometimes. Please let me know, what should I do?
Yeah, so this is a common problem. When you know that you are doing workout, you are doing physical active, nothing you are done unusual on that particular day, but suddenly without any provocation, you are not anxious, you are not worried, nothing, routine activity, suddenly heart is erratically, you feel something is going wrong. That may be the first sign of some erratic heart beating. So the way to monitor is, if you want to know the pulse rate, if you are capable, you can do the pulse rate monitoring. Or nowadays, all the mobiles having heart rhythm monitoring apps, pulse rate apps are available. So you can download it and put your finger under that, and you can show what is your pulse rate at that point of time. As I mentioned, without any provocation, heartbeat goes very fast, like 140, 150, without any exercise or anything, that becomes abnormal. In those cases, if you are suspecting, if it happens daily basis, we do monitoring called 24 hours monitoring, which is called Holter monitoring. The small devices connected to your body, any of these hospitals, so that records your ECG for 24 hours continuously. You do your work and workouts, everything you can do with that machine. And then we can analyze that, remove that 24 hours later, we'll analyze it, what happened exactly. So during the rhythm, when you got symptoms, otherwise also if there is any rhythm disorder is there. Some people we recommend to go extend it for a 1 week monitoring also. Suppose some people get once in 2 days, once in 3 days only they get the symptoms. So 24 hours monitoring may not pick up that rhythm disorder. So we go for extended monitoring, like 1 week, 2 weeks also. We can record it by putting a smaller machine in your chest. But you can continue to work whatever you are doing, activities, job, everything you can do it. But just simply monitors your heart rhythm for 1 or 2 weeks also. By analyzing that, we can find out what sort of rhythm disorder you are getting it. Is it physiological or something pathological? That it needs any treatment or it needs only reassurance, or that will diagnose and tell you.
What are the causes of atrial fibrillation, doctor? And is it hereditary?
Yeah. So if you come to atrial fibrillation, which is one of the most commonest rhythm disorder in the world today. Okay, that's so all over the world, that is a burning problem in rhythm disorder. As the most commonest etiology, if you ask, that is the age is the thing. So as we know that people are living now beyond 60s and 70s are commonly, we are seeing age groups, 60s and 70s and 80s. One of the commonest rhythm disorder which you face is the atrial fibrillation. What happens in atrial fibrillation is actually, in fact, the last month was entire month was celebrated as worldwide as a atrial fibrillation awareness month, because the lack of awareness and lack of treatment knowledge, it's a burning issue. And this is the commonest arrhythmias which brings the patient to the hospital for rhythm disorder. So because when the heart rate goes very fast, like 150, 180, the patient gets into breathing difficulty, especially this happens at old age, they will not tolerate it. Either they lose conscious or they become chest pain or breathing difficulty. They rush to the emergency to overcome problem. Other most important issue happens the atrial fibrillation. Why this awareness also created is stroke. Whenever the heart, what happens in the atrial fibrillation is the upper chamber of the heart, what you call atria or auricle, it beats at the rate of 500 beats to 600 beats per minute. It is literally fibrillates, it doesn't contract. Because it is not contracting, blood stagnates. Once the blood stagnates, it forms a clot. The clots can go to the brain, can cause stroke. So potential problem is the stroke. That's what one disease is creating other problem. This atrial fibrillation, erratic heart beating, which can cause palpitation to the patient. Sometimes it comes on asymptomatically, patient not even aware that his heart is beating erratically, but he come to the emergency with the stroke because of the clot has gone to the brain and causes stroke. So the common etiology, if you ask what is the thing, as apart from the age, which is the most commonest, hypertension, diabetes, those who suffered a heart attack in the past, their pumping is very poor, and those who have the thyroid disorders or those who have the lung disorders like asthma, COPD patients, and those who have the obesity and obstructive sleep apnea. These are some of the commonest reasons the people will get into rhythm disorder, that is atrial fibrillation, which can lead to stroke as well as the heart failure symptoms like breathing difficulty, other things. So anybody becomes the stroke, unexplained stroke, we investigate for any, are they suffering from atrial fibrillation? That is the most important thing. And if they come with atrial fibrillation, first thing we do is protect the brain by starting a blood thinner, that is called anticoagulation, so that they should not get into stroke problem. And then we will address the atrial fibrillation by either medical treatment or, as I mentioned previously, the radiofrequency ablation, which is potentially find out where is the source for this excessive impulse problem, and then do the radiofrequency ablation, which can control and correct the problem in 80 to 85% of the patients.
On the contrary, a stroke can be prevented if and when the patient feels his heartbeat is irregular or he is having palpitations.
Yeah. So the palpitation is a very vague symptoms. The palpitation is, what do you mean by palpitation? One's awareness of own heartbeat. You are just aware of your own heartbeat. As I mentioned, the heart is beating in 60s and 70s. You don't feel your heart is working. But when the heartbeat is rising very fast, then you are started feeling your heart is beating fast. It normally happens when you climb, when you run, all those things. But when you, without any provocation, it happens, you start feeling palpitation. But it is a subjective symptom. It has to be documented. And then we need to find out what exactly is causing that palpitation. So if it is a abnormal, as I mentioned, if it is a pathological, without any reason, heart is beating fast, then it has to be identified, it has to be treated appropriately.
What is the prognosis of heart rhythm disorder, doctor?
It's a very, very important thing. So prognosis, as I mentioned, broadly we can classify into the upper chamber problem, lower chamber, that is atrial problem, otherwise ventricular problem. The atrial arrhythmias, by and large, we commonly call supraventricular tachycardia, SVT. The prognosis is very good. They don't die off suddenly, but the sudden death is very rare, and most of the things are potentially curable by radiofrequency ablations. Other upper chamber commonest problem is what I discussed now, the atrial fibrillation, which again it doesn't cause sudden death or a life-threatening problem, but it can cause stroke. It can make you disabled lifelong. The patient, because of stroke, he can be disabled, or the patients may get into breathing difficulty, repeatedly come to the hospital because of the palpitation, other things. Again, this can be corrected. It can be cured. It's corrected by radiofrequency ablation, or it can be corrected by antiarrhythmic medications. But on the contrary, the lower chamber problems, that is ventricular rhythm problem, ventricular tachycardia, which can be life-threatening, which can, a patient can die even before reaching the hospital. Within few seconds of onset of symptoms, even they may, they were not able to call for the help also, they may collapse. That's why you may face from somebody while sleeping died, somebody walking roadside collapsed and died. So you would have seen many patients within a matter of 1 or 2 minutes, their life finishes. These are all called sudden cardiac death. The most common reason is a ventricular rhythm problem. The lower chamber suddenly started beating very erratically, 200, 300 beats per minute, and stops working. Then it called sudden cardiac arrest. So this is a potentially dangerous problem. So those patients are lucky enough to survive after suffering this, either because of the bystander started doing cardiac massage, or they can able to seek the medical help immediately. They are survived from that. They cannot take one more chance. they have to go for what I mentioned, the ICD implantation, so that when they face this problem next time, the machine will revive their life. That will be safe. Some of the ventricular arrhythmia problems are again still good, as I mentioned, younger patients getting any rhythm disorder from the lower chambers. Otherwise, their heart is perfectly normal. They are not suffered any heart attack, otherwise perfectly normal. And that is potentially curable by radiofrequency ablations. Other potentially lethal problem happens is the genetic problem. Some of the lower chamber problems, which is erratic heart beating, comes in the family or comes in the genetic in nature by birth defect. Heart can suddenly go beats erratically, and within a matter of time, heart stops, which is called sudden cardiac arrest due to channelopathies or hereditary disorder. If you come across from the ECGs and other diagnostic modalities, if you find patients are suffering from that disorder, how would you find out? The patient, suppose they lost their own brother or sister suddenly. When they get evaluated for why the family member suddenly died, when they will come to know that there is a disease which runs in the family, because of that the father or brother died suddenly, then the surviving member will ask, am I suffering the same problem? Then if it confirms that he is also suffering same disorder, then we put a device called ICD, because he is also carrying the very high risk of dying suddenly because of the genetic background which he is suffering, which cannot be cured by any of these medications or anything. So the machine, whenever he gets a life-threatening problem, machine saves his life. So it is some of the upper chamber, most of the upper chamber problems are non-life-threatening, and most of the lower chamber problems are life-threatening. So where is this erratic heartbeat is coming from? That becomes so. Both will cause to the patient symptoms are palpitation, only palpitation. But it's only by a doctor can diagnose it by any of these electrocardiogram, ECG, or Holter monitoring things, then classify it, which one is he suffering, then how we should be treated, whether by medicine or by curative treatment by radiofrequency ablation or any sort of device to be implanted, so that he will not get into a life-threatening situation.
Hello, doctor. I'm 27-year-old male from Madurai. I am weighing about 110 kgs. Over the past few months, I've lost almost over 25 kgs due to gastrointestinal issues, basically belching. I have a habit of monitoring my heart rate, and at resting, it's usually very low, to the range of 45 to 52. I would like to know if this might be an underlying issue. Should I be worried? Should I get it checked? Kindly let me know.
Yeah. Anybody's heart rate is below normal, better to get checked up on ECG, and thing is better to check it. First thing. Second thing is he lost suddenly weight from significant weight loss happened in a short while. And also the weight which he is mentioning is definitely was obese, on 27-year-old guy, so 120 is a weight overweight. And for his physical activity, the heart rate seems to be very lower side. So you would have been not very much physically active, but the heart rate is on lower side. So I think better to have a ECG done, and it may not be alarming. We don't go by the numbers. The 45 or 50 doesn't matter, as long as one does not have any symptoms. The low heartbeat treatment based on the symptoms. So the number doesn't matter. If you have a symptom or not, even though pulse rate is 48, if you have 45, if you don't have any symptoms, there is no dangerous problem on your ECG, then you don't need any treatment. You can lead the normal life.
Hello, doctor. I'm 64 years old man from Madurai. My BP and sugar are perfectly okay. For the last 1 week, I'm feeling that my breathing is fast, though not out of breath. There's no chest discomfort also. Heartbeat is also within 75 and 80. What could be the reason? Should I undergo any particular test?
Yeah, considering his age, even though if he is hypertensive, diabetic, well under control, or if he is not suffering also, anybody is beyond the age of 40 years, better to go for regular health checkup. So because he is having some rapid breathing, something he feels something unusual happening in the last 1 week, better have a health checkup done, which can be a master health checkup, or it can be a cardiac health checkup, which includes on sugar, cholesterol, and ECG, echo, treadmill, and X-ray, which is a part of any hospital will do the cardiac checkup. Better to have a checkup done. So what is the reason for his unusual type of breathing, and let the doctor checks all the reports. If it is normal, nothing to worry about it.
Speaking of treatment options, can heart rhythm disorder be treated permanently?
Yeah, Most of the rhythm disorders, especially upper chamber, that is atrial problem like supraventricular arrhythmias, SVT, it is potentially curable problem by radiofrequency ablation. We don't recommend the patient to take lifelong medical treatment and suffer with that. We recommend them to go for electrophysiology study and meet the cardiac electrophysiologist and identify the problem and cure the problem with radiofrequency ablation. They can lead the normal life without any medication. These procedures are done by keyhole procedures. No cutting, no suturing, done under local anesthesia. It gives permanent solution to the patient. Some of the life-threatening ventricular problems needs implantable devices, which can be a heart failure device like a CRT or ICD, to improve the ejection fraction and prevent sudden cardiac death. And structurally normal heart, some of the problems are also curable by nature. So we must insist the patient, those who are suffering from rhythm disorder or symptoms related to rhythm disorder, meet the cardiac electrophysiologist, who is a specialist in rhythm disorder management, which is a subspecialty of a cardiologist. They should go to the nearby specialty where the doctors are available, get thoroughly investigated by various monitoring devices, ECG or Holter monitoring or 1 week or 2 weeks recording, treadmill test, and then identify their exact problem, what is the rhythm disorder they are suffering from, or they need to take medication, or they go for a curative treatment by radiofrequency ablation, or if their pumping is weak or they are already suffering from some structural heart problem, they are undergone bypass surgery or angioplasty, and then meet the rhythm specialist, or they need to take any devices to prevent sudden cardiac arrest in future, or somebody is in their family died of suddenly, and meet the electrophysiologist, get it thoroughly investigated. Are they carrying any genetic problems which can transmit in their family, which can take away their life just like that? So they are to go for ICD implantation. So we recommend we to go to meet the electrophysiologist and get thoroughly investigated if you suspect having any rhythm disorders by symptoms or by any ECG.
What would be your message to our viewers today, doctor?
It's to stay healthy is very important. When the patients are, when they suffer and they come to the symptoms of cardiac, everybody common awareness in the cardiac thing is the most common is a heart attack, which is very, very important. The people think the risk factor heart. But in the heart also, the most important other thing is the rhythm disorder. We call the know your pulse. So any pulse related disorder also can lead to be lethal, and then it can lead to life-threatening problem or like a disabling stroke or anything can happen. So what we recommend the thing is, when you suffer from palpitation sort of symptoms, don't neglect it. Don't reassure yourself because of the anxiety, tension, stress it is happening. If you feel something unusually happening in your heartbeat with erratically beating, or if you're losing conscious, meet your cardiologist or cardiac electrophysiologist, look for any rhythm disorders, and then diagnose it appropriately and take appropriate treatment to avoid either stroke or sudden cardiac arrest. And having a healthy lifestyle, healthy food, and control of blood pressure, hypertension, maintaining ideal weight, avoid too much of caffeine related items, also helps you to prevent this sort of heart rhythm disorders.
Thank you very much for a wonderful session, doctor. Thank you, viewers.
Thank you.